So now a couple of words about the adverse effects of anti-seizure medication. You probably all know that they have tons of adverse effects. And that's probably also due to the patients are on these drugs for a very long time and might experience the one or the other adverse effects over time. Now, for all of them, you're going to have some sort of CNS effects. They act in the brain. They reduce electrical activity. So all kinds of things where you need electrical activity in your brain will be decreased, and there might be problems. So examples are nystagmus, so the dancing eye, diplopia, double vision. You can have a tremor, you might feel fatigue, might feel dizzy, there might be also ataxia, you might have problems with smooth movements, that's probably due to decreasing cerebellar activity. So all kinds of stuff that all involve just decreasing electrical activity in your brain. That's predictable, and that's going to be true for all of these medications. I also want to mention that all medications are teratogenic. So now having a seizure during pregnancy is also very dangerous. Therefore, generally, if a woman gets pregnant on any of this medication, they're normally staying on this medication just to prevent the seizure. Now, there's only one exception. Valproic acid has a black box warning for its teratogenicity and is even more teratogenic than all the others. So for valproic acid, the Valproex, you would take the woman off this medication and find another one. So now let's get a little bit more specific and talk about some specific anti-seizure medication and their adverse effects. So I'm going to start with phenytoin. And what does phenytoin do, and what are important take-home messages? So number one is a P450 inducer. So it induces particularly 3A4. So that's obviously important when you're thinking about interactions with drugs. Then it causes hirsutism. So that's enhanced hair growth, so when girls start to look like dudes. Then E for enlarged gums. That's kind of another term for gingival hyperplasia. So it turns out that phenytoin is also released into the saliva, and in the saliva it can then stimulate from the saliva it can stimulate connective tissue in the mouth, and that leads to enlarged gums. And that's obviously a problem because it can do this so significantly that even your teeth can fall out. So dental hygiene is very important. Then it can cause nystagmus. Again, that's something that basically any anti-seizure medication can cause, but phenytoin is so good at doing it that you can even use this kind of to check if the patient is compliant, because if there's no nystagmus at all, that would be rather untypical. Then it is teratogenic, as most anti-seizure medications. It causes osteomalacia. So it causes a softening of your bone. And that is due to its metabolism is also hydroxylated, and it competes with vitamin D also for the hydroxylation. And we need the hydroxylated vitamin D. That's the one that we need for proper bone formation. Then it interferes with folate. So it looks a little bit like folate and is taken up, can compete with the uptake for folate in the GI system. So you might get a little bit lower folate levels. So worst case scenario, this could lead to megaloblastic anemia. And then it causes all kinds of neurological problems. Now, what should we remember for carbamazepine? So carbamazepine is a sub-inducer as well. But now, very important, carbamazepine induces its own metabolism. So you could imagine the scenario that you put a patient on carbamazepine, and after a couple of weeks, the patient might experience another seizure, and this is probably because it's an auto-inducer. It has induced its own metabolism. So therefore, therapeutic levels are going to drop. Then it's one of these drugs that increase ADH, and that's kind of something that might then lead to hyponatremia, which is obviously not good because hyponatremia by its own is a trigger of seizures. Then it leads to a rash. And that's an important consideration because there's now even a black box warning on carbamazepine that warns for this rash that are found predominantly in Asian patients because they have identified a specific HLA gene that is correlating with this rash. And this specific HLA gene is found predominantly in Asian patients. So if you want to put an Asian patient on carbamazepine, you need to do genetic testing in order to prevent this rash, which is very dangerous because it can progress to Stevens-Johnson syndrome. And then it can also lead to blood dyscrasias, and that is really one of the drugs that can lead to an aplastic anemia, so it basically dissolves the bone marrow. So that's it for carbamazepine. Now a couple of words about valproic acid. So valproic acid leads to weight gain, so valproic acid for weight gain. And then it also leads to alopecia, which is kind of interesting because we just discussed a drug that leads to hirsutism, and now we have one for that leads to alopecia, so kind of exactly the opposite. Too much hair growth, you lose all the hair, which is interesting because they even have a similar mechanism of action, so they share at least one. So you can see here that these are kind of a pretty random number of effects that we see with these anti-seizure medications. Valproic acid is also very liver toxic. And that might be also a reason why they put now a black box warning. There's a black box warning on valproic acid that you cannot use it in kids. In children, liver function might be not as developed, so there's less liver enzymes that metabolize valproic acid. So you might even expect higher levels of valproic acid if the liver cannot metabolize it as well. Lastly, I just want to mention for lamotrigine for a life-threatening rash. So lamotrigine can also lead to a rash, kind of similar to carbamazepine. The difference is for lamotrigine, it can just happen. We don't have any clue for carbamazepine. We have a clue. We have this HLA gene correlation. Lamotrigine, if you would see a rash in a patient, you would immediately put the patient off this drug. Topiramate can lead to some cognitive impairment, which is obviously a problem in students and kids. So that's one problem of topiramate. And another one, it also leads to weight loss. And it's so good in that it even got approved as a weight loss drug together with another drug. So this concludes the video on mechanism of action and adverse effects of anti-seizure medications.